Good morning, everyone, and thank you so much for joining us on the third colloquium talk of the quarter. It is my pleasure to introduce today Blair-Freese. She is a program officer at the Bill Melinda Gates Foundation, focusing on the delivery side of health interventions such as vaccines and drug distribution, particularly in developing countries around the world. She's also a recent graduate at the University of Washington from the Foster Business School and holds a technology management MBA from the UW. And so I'm glad to have you here, Ayo. The floor is all yours.
Thank you so much. Yeah, as Shruti said, I'm Ayo Blair-Freese, and I work with the Gates Foundation. I just celebrated 8 years, and so I've been running what we call our geospatial information support team, which I'll be talking a bit about here in a second. And I get to play with maps, which I think is actually the coolest job at the Gates Foundation. And so if anybody tells you any differently, they're wrong. So here's the format for how I'm going to go through this. So I'm going to give an introduction to the Gates Foundation for those of you who may be less familiar, and talk a little bit about where my team sits. And then I'll also give you a little bit of an introduction to geospatial analytics, the things that we really care about in the development space. I'll go through some examples of where we're using geospatial data in applications in humanitarian settings. And then I'll talk a little bit about what we hope will happen in the future, and what kind of needs there are still in this space, and how people can get involved and start thinking about the future. If you have any questions, I am a fairly informal person in general. So you can always raise your hand if you have a clarifying question while I'm presenting, especially if something is not jiving. If you're a little confused on what I'm talking about, feel free, please raise your hand and ask whatever questions you have to clarify. It would be nice to hold some of the discussion questions until the end. That way we can get everybody involved and have a really good discussion. I'm hoping to leave plenty of time for us to get into some of the discussion questions and curiosities and things that you might have about me and the work and the way that we work at the Gates Foundation. Anything that you want to ask, that time is yours. So a little bit of history about the Bill and Melinda Gates Foundation. So this all kind of started the brainchild of Bill Gates's dad, Bill Gates Sr., in 1994. So started working specifically on disease areas where we thought we had the ability to use some of Bill's fortune for impact. Take that all the way to now. Well, 2011 was when the foundation finally settled on our permanent home. We are based here in Seattle. And so our headquarters are just down right next to the Space Needle. Unfortunately, the offices are not open right now, so I am calling you in from my home office here in Wallingford. But I'm also Seattle kind of local, and so really exciting to watch the history of the foundation play out. And then, of course, 2 years after the foundation settled in their permanent home, I joined and started working on maps with the Polio program, which was one of our focus programs at the time, and that work has grown since then. I like to show this slide because the Gates Foundation has a really wide reach of programming. We don't just work on disease areas like polio, which I think are the ones that get the most attention in the news. We also work on things like water, sanitation, and hygiene. We work on agriculture. We have programs for all types of disease areas, whether that be malaria, I mentioned polio. We've got neglected tropical diseases that we work with. We also have work in nutrition and other areas like that. And the reason I like to show this slide is because I work in an area that cuts across all of these. And so I actually have the very fortunate privilege of getting to intersect with all of the different areas of the foundation, especially on the global work that we do. I don't do so much on the US side for some of the US programs that we have. But just about all of these interventions that we run at the Gates Foundation happen at a time and place. And since maps are all about time and place, I get to work with all of these folks, which is why I say that I have the best job at the Gates Foundation, because I get to see the impact all across the board. This is my team, the Geospatial Insight Support Team. I've got on the top here a little bit about the hierarchy, although it's backwards. This is kind of the top level unit on the right-hand side that goes all the way back to where I sit. But we're a very small team of folks specifically interested in looking at how to use better spatial data or location data to make sure that our interventions have a better, more equitable reach. And so making sure that everybody has access to the goods and services that we have, especially the least fortunate, and that those programs also reach their maximum value, which I'll talk a little bit about as well. I love this slide. This is actually from a slide deck that folks no longer use as part of a foundation introduction, but I thought it was especially relevant for this presentation and for the work that I do. Because at the foundation, they used to say we do two things. We focus on the areas of greatest need and the areas where we can have the greatest amount of impact. Knowing that this colloquium is about effectiveness and responsible use of technologies and data, these questions, I think, perfectly line up with these two areas here. So, responsible, what are the areas of greatest need, making sure that we're using our money and our resources responsibly to achieve that great need, and then effectiveness, where can we actually have the greatest impact? Those questions seem to be kind of two sides of the same coin, but they're not really once we start to decouple some of the, I think, things that are embedded in those questions. So if we look at what are the areas of the greatest need, we're really focusing, especially on the spatial side, on the map side, we're trying to find where are the people who need these interventions the most. So are there communities that are being overlooked, especially overlooked, on a consistent basis? And so they're really not getting the vaccines that they need or the malaria nets that they need, even though they're the areas that really could benefit from them the most. And then, who are the governments and organizations who serve these people? Money alone can't solve these problems. We need to work in an infrastructure of people and governments that help facilitate a lot of these interventions. So, the governments that write the policies so that we can have things like COVID-19 vaccines, there's a government regulatory system for that. And so we also need to really understand what is the infrastructure that supports those people who are of the greatest need. And then on the other side, we have where can we have the greatest impact? The question, where can people benefit from these interventions the most, is slightly different than the people who need them the most, because it might be that you can actually have greater impact in an area because maybe the technology is better, and so the interventions can spread a lot faster. If you think about great supply chain networks, for instance, if we bring bed nets into a country, and we hit an area like an urban area where we can get those bed nets out within a day to everybody because it's a highly dense city, we might be able to have bigger impact, but we're going to be missing, again, those populations that would be harder to reach, but would take more resources. And then, of course, how do we maximize that reach to the most people? So again, there's always a little bit of a trade-off here between maximizing the number of people we can hit and the amount of impact we can have, and making sure that we're also doing so in a responsible way that really doesn't ignore that there are people in those communities that are being overlooked on a regular basis. And all of this really connects. I've got the line on the bottom there. All of this really connects with maps and the work that I do, because these questions connect to the locations of settlement. So if we want to know where people are who need these interventions, we have to know where they are, where they are geographically in time and space. And I'll show you an example, but that information isn't always as easy to find as just opening your phone and opening Google Maps here in the States. We also want to know things about the people. So, what makes them the people who are of greatest needs, the demographics of them. Are they, elderly population who are more at risk for, things like COVID-19? Are, how many people are living in an area? Is this a really highly dense population, or is it very spread out? How many people should we be buying vaccines for? Do we need to bring more or less as part of these interventions? We also do a lot of work around government boundaries. As I mentioned, we do want to really understand who serves the people that we're trying to reach. And so if we have a better understanding of where what we call catchments are of people who live within these government boundaries, we know where those populations are being missed and who is supposed to be serving them. And the same exists for infrastructure. So understanding the number of hospitals, for instance, that a population has access to. If certain populations don't have access to things like family planning care, then that whole population is going to be missing out on things like skilled birth attendants who stop things like maternal mortality. And so we want to make sure that that infrastructure is just right for the cases that we have at hand. And so these kind of pieces at the bottom are what I think of as the 4 cornerstones of the work that we do within Geospatial Insights support team. As I mentioned, I have an example here of oftentimes what is the existing maps that we're working with at a local level when we're talking about distribution of goods and services. And so I have so many examples of hand-drawn maps like this, which are good, which are really helpful when you're planning at a local level. But think if you're doing, a whole national campaign trying to get polio vaccines out to every single child who wants a vaccine. It would be really hard to plan the number of vaccines that you would need to bring into a place if this is the zone map that you're working with, because there's not a whole lot of data around how many people live in these houses, how many people here have children who are of the age to take the vaccine. There's a little bit of information about the transportation, although it's hard to understand if the thing going through the middle is a river or a road, and how we might actually reach these people. And so when we start to do operational planning based off of some of the existing data infrastructure, oftentimes this is the best thing that we have to start with. And so taking this into a digital system, using data and remote sensing data, so data from satellites and data from other public sources to triangulate what the possible statistics are of the population here. Those are the types of things that we would do in order to take it from this into, kind of the now. And I'll show an example of what that looks like. And so this, I think, was specifically from Ghana, if I have my sources correct. And so here's my first example of something that my team funded and I work very closely with in order to solve some of these gaps and issues. So this is the Grid 3 program. And this is co-funded by the Gates Foundation by my team and UK's aid organization, also known as FCDO. And it's a network of partners who we fund in order to get better geo-referenced infrastructure and demographic data. So their specific vision is to partner with governments to create spatial data solutions for development challenges. So taking things like that zonal map that you saw before and working with the government in order to update that. And these are the types of data points that they're really focused on collecting. So we talked about boundaries. Health boundaries is one of them, government boundaries being an important one I talked about earlier. And so that's really to understand, what is the infrastructure that serves your population. Understanding things about the population themselves, again, numbers and demographics are incredibly important to knowing what we need to supply. Finding the settlement locations themselves. There was in the lower left-hand corner, you see a guy with a tablet. That was actually part of a program where we were in northern Nigeria, finding populations that didn't exist on even the government maps because they were really small settlements that just existed out in the middle of nowhere. And even we find that occasionally here in the US, you have people who spring up in the middle of deserts. And when we get information that there are people out there for the first time, we want to make sure that they have access to health, infrastructure, access to things like running water and other essential resources. And then understanding facilities. So again, that's that infrastructure piece. What does exist? What hospitals and things already exist in these areas? And they work through a series of data collection, modeling, and then working with governments and local actors on how to use the information. And so this is a very kind of timely, important example. So I don't know how many of you know about COVAX, but that's one of the mechanisms that the Gates Foundation and others fund in order to get COVID vaccines to countries that otherwise couldn't afford them. And so one of the things that we do as part of that support, if the countries can't afford the vaccines, they probably can't also afford to update their plans and infrastructure in order to get all of those vaccines out into the field. And so we used our mapping work that we had done previously for other disease areas, primarily for polio and yellow fever, in order to bring that data into systems to help specifically planning for COVID-19 vaccine distribution. And so understanding, where the vaccination sites were. So, you got your vaccine at a school, like I got mine in a school parking lot with the fire department. Understanding where those potential sites are and what populations exist in that area. So we know, again, how many vaccines to produce and get into the country. Also understanding where you can have temporary vaccine sites that come up, maybe for a mass vaccination day to try to get everybody in one shot. No pun intended. Also looking at, again, those demographics to see what populations are of the greatest risk. If we have a stronger elderly population, maybe we'll prioritize that first. And so really understanding spatially where we need to start focusing and distributing those vaccines. Looking at things like requirements, I've talked a little bit about the regulatory space and really needing to understand like what is required in order to get these things out into the field, and do we need to actually work with the government to make sure that all of those things are in place. And we printed over 700 maps for Nigeria just using this data infrastructure in order to get those vaccines moving. And that was something, so if you think about it, it's like a county level in Nigeria. Every county had a plan that looked like this, that used that spatial data. When I started this work 8 years ago, we still had hand-drawn maps like the ones I showed earlier that we used for this type of planning. And so it was really amazing to see how far this work has come and how we're able now to just go in and do it really quickly because we already have that data infrastructure. I have another example. So this is a group called Macroeyes, and they are big in the AI space, trying to understand a little bit about how resource allocation can be understood without even having people go and count all of the things on the ground. I'll talk a little bit more about what that means. But they were looking specifically, so again, I'm going to use COVID-19 because it's so timely. Looking at health facilities, so hospitals and clinics and other what you might think of as health infrastructure, trying to understand really like what could be in those facilities without having to go knock door to door to door, go to every Bartell Drugs and CVS and Swedish Hospital and UW Medical Center and ask them to count their staffing and their vaccine supply. Are there ways that we can actually use artificial intelligence to look at things like stockouts and try to understand where their vaccine supply is, if they need more or less? And so these were some of we talked to the government of Sierra Leone as part of this grant to try to understand what their priorities were when looking at COVID-19. So they definitely wanted to look at the supply chain for both their regular immunizations, the regular vaccines, and also stockouts for COVID-19 vaccines. So again, without going to every single place, can we try to make sure we have the most efficient routes for people to get vaccines to the places they need to be? Human resource distribution was another one. So do we have enough doctors and nurses and skilled attendants for the size of the population? Do we need to be moving staff around so that we can have, or hiring new staff so that we can have facilities with the right number of folks who are staffing them? Understanding the facility infrastructure. So sometimes, if your data systems aren't up to date, it'll say there's a hospital. And then, sometimes this happens even when I'm on Google, when I go to a restaurant and it's closed, that kind of information, especially in a data poor environment, they don't know where all of those closed facilities and things are. So we don't want people showing up. Sometimes they're traveling by foot a couple miles. We don't want them to show up to a place that's closed that they can't get their vaccine or services. And then maternal and newborn care, this is a non-COVID related thing, but when we were talking about AI uses, they really wanted to make sure that they could track where mothers were, because there's so much that goes into timing when you're working with maternal and newborn care. And so making sure that we could track when people needed to come back, what things we needed to check up on, so that it wasn't something where the mother would have to memorize all of these things, or the facility would need to be keeping track of it on paper. How can we use AI to tell us some indicators of when people need to come in and start that work? And so we produced this tool called Striata. Of course, our first use cases were specifically around COVID-19. And so the first thing that we wanted to do, again, was to, without even going to any of the facilities, with a little bit of survey data that we had, understand how ready are the hospitals and clinics for COVID-19, both patients who needed care after they got sick, and for vaccinations. And so one of the first thing that they did was take all of this data from satellites, from surveys, from local intelligence. They put it into an AI machine, and it said, all right, in these urban areas, we're a little bit more ready than they are in rural areas. Some rural areas are actually quite ready because they have more staffing and infrastructure, because of the size of the population, whereas others may not be. So that was a really helpful thing just at the very beginning of pre-planning. Again, names and locations and whether places are open were really important, as we started to tell people where to go if they got sick or if they needed to get a vaccine, which that's actually still, vaccine rollout is still happening in Sierra Leone. Understanding, again, those specific supplies and resources. If you're not going to every single clinic or having them tell you how many doctors they have on staff, can we estimate it? Because maybe most urban hospitals have 3 doctors, and so you can kind of make assumptions in your model based off of that. And then really helping them make the plans, kind of like you saw before, as the next step as part of this process. One of the very specific examples that I like to talk about, because I think it really grounds it for people, are understanding like how many people a facility is supposed to serve. So if I look at, I'm thankfully right next to the UW Medical Center, and I can walk anywhere that I need to get medical care. But I know a lot of people who drive from the east side, for instance, and come get their medical care because they're maybe a graduate of UW and they, still have some connections, or maybe it's better under their health insurance covered. And so oftentimes what we do, especially when we have data poor environments, is we look at a hospital and then we draw a circle around the hospital and we say the hospital is supposed to cover all the people in the circle. Except that's not really the truth if you have people who are driving all the way from the east side and people like me who are in the circle and we're part of the population, but maybe my neighbor, she's part of the Swedish network, so she wants to go somewhere else. Or maybe we, they don't have the type of specialists here that we want to see, and so we go to a completely different city for the care that we want. Well, that's a problem. That's a problem that we have here in the U.S. It's a huge problem when you look at developing areas where they don't have the data infrastructure to really understand what people's wants and needs might be. And so this was one of the things that we started to model, especially when we were looking at, how many vaccines or what, how much oxygen should we be supplying for COVID-19 into a hospital. Actually looking at some of the what we call care-seeking behavior. Why is it that I would go to the UW versus going to Swedish? And how can we actually put that into artificial intelligence, put that into a model? And again, this is so that we're using our resources effectively and we're serving the underserved populations who we want to be responsible for. This is the last section. So what do we actually need, I think, now into the future in this kind of space with maps and global technology? For me, a lot of it is around ownership. So the problem here, most of the planning work that I've been talking to you about happens within government ministries, but governments, we hope, turn over. I mean, if we have fair and democratic processes like we do in the US, or governments turn over every 4 to 8 years, and that's a good thing. But that also means that if we're training up government officials, we want to make sure that those government folks have other people in their community that can use the data, use the infrastructure that we're putting together, use the plans And so one of the things that I work on specifically is also working with the private sector through seed funding, business accelerators, just direct investment in some of these private sector partnerships, so that people can have long-term solutions that they're building in the countries directly with the government, relationships that we have, making sure that those connections are made. There are other solutions, and that's one of the things I would love to hear from folks. What are your ideas for potential other solutions for how these things can be owned in the long term, understanding that a lot of the folks that we work with do turn over. And then new research areas, obviously, is a big one, especially when you look at kind of the high income country to low and lower middle income country divide on technology. Some of the solutions that we develop here in the United States, things for our smartphones, for instance, are not always fit for use because maybe internet connectivity is not as widespread in the areas that we're working. So what are other ways that we can have technology that is really fit for purpose? And one of the solutions, of course, is to engage with universities and academic institutions, both within high-income countries, so the places where we have resources that we can dedicate, and smart scientists who might want to work on these problems, with people who are actually working, in these countries where they can see what the problems are, and they can better explain some of the issues that might come up. One of the examples that I like to give, because I think that people also think of this as like an issue of, we have better technology, better connectivity. But sometimes, it's not just about making sure that technology specifically gets into these countries. If we think of the financial technology industry, people like I have Apple Pay on my phone, but I don't usually use it. I just usually use my credit card because it's a little bit more convenient. Not everything takes Apple Pay, and sometimes it's difficult to get my facial ID and things ready. Credit cards are not hugely popular in places like sub-Saharan Africa. They don't use plastic technology, but they do use phones, and they're not always using even smartphones. They're using feature phones oftentimes. So just being able to text and do banking over text and send payments, even just to local businesses over text, that's a technology that was developed, that financial technology, fintech, was developed more for the developing world than it was for kind of these high income countries. And so they leapfrogged right over us. They saw us using plastic credit cards and said, nope, we're going to use our phones. And then, Apple finally got their act together and was like, yeah, and Google and the other folks. They're like, yeah, you can actually do banking and payments directly with your phone. And so sometimes it's not just about making the technology something that we take from a high income setting into a developing setting, but also, what are completely new ways of thinking about technology that will be more fit for the environments that we're working in. So that is the end of my presentation. As I said, I would love to have ample time for you to ask questions, and go ahead and ask questions about working at the Gates Foundation, about kind of my role, my team, or about the work that we do. I'm happy to answer anything.
If you have questions, you can also unmute yourself and chime in.
Maybe I blew y'all away with just how cool these maps are, huh?
Yeah, Mike Rhodes here. I've got a question. Curious if you could go a little bit more detail in terms of what the kind of the training data you used when you talked about the ML, I think Macroeyes ML platform that you used to kind of determine the viability of the medical centers.
Absolutely. So we have old surveys called SARA surveys, S-A-R-A, which do look at things like, how many doctors can we expect in certain clinics, or what are the general stock levels of your anti-malarial drugs. And so we have older surveys that ask some of those questions of samples of facilities. And so One of the things that we did was we took recent and historical satellite imagery, and we said, okay, this is what the world looked like when we took these survey samples. And then again, we had, I think, some other people who, once we started doing the modeling, actual people on the ground who were giving us feedback. But we took the satellite imagery and we took the surveys at the time they were taken and said, this is what we expected the world looked like about this time. And we were able to, again, because these were just samples, it wasn't a fully representative of the entire country kind of survey. We were able to extrapolate what we thought the world kind of looked like at that point in time. And then we updated that with newer satellite imagery. And again, we actually had people who were government officials, who were people who were working in hospitals, a sample of people who were giving, so this was a human in the loop, as we call it, AI model, where they would go and look at it and they would say, oh, you think that the Capitol Hospital has 14 doctors? Like, that seems a little low. We think that, we can probably tune this a little bit better. And so we have this community of people who are looking at that satellite imagery and the kind of extrapolated survey data, and then giving their own kind of opinions until we were able to finally tune things. And we have done some surveys, some just like little drop-in surveys with some of the vaccine distribution activities. And we're finding over 70% accuracy in a lot of the modeling that we did as far as the actual infrastructure, which, I mean, for an entire country's, every single clinic that exists in a country to have over 70% accuracy when you're trying to look at things like how many pills do they have for malaria. I mean, that's a super, super helpful metric, and it saves millions of dollars. I mean, if we were to do that type of a survey and go out to every single clinic, that would cost us, in the upwards of $10 million just to get that kind of data. But we were able to do it for less than $500,000 of that whole infrastructure, getting all the data that we needed, getting the people who needed to input and all of these things.
Very cool. And just a follow-up. So on the geospatial data, so in terms of like the features you're extracting from the satellite imagery, was it kind of like number, you talked about drawing the circle around the medical facility, like counting numbers of buildings, or, I mean, what exactly were you extracting from the images?
Yeah, so it's funny because we tried to do a number of things. So at first we were really just looking at, we could match up the points that we had from the survey, from the facility, to the actual infrastructure location. And so at first what we were doing was we were looking at built infrastructure. So we were looking at, is this facility close to another facility? Is it close to, a big city? Is it close to a kind of urban or rural area? And that was somewhat informative when we were looking at it. If it's close to another facility, maybe they're giving, if one of them has a stock out, they'll give stock to the other ones. You don't usually end up with stock problems. Same with skilled workers. If you're in an urban area, you're more likely to have people. And then we started including everything. And when I say everything, I mean everything. Like, where's a river nearby? How green is this area? Is this close to a border or not? And when we started including everything, the model accuracy increased. And so, it's hard. I don't have the charts in front of me, but there were some things that came out about specifically things like borders. So whether or not you're close or far from a government border actually has a huge impact on the type of resourcing that you have. And so that was something that we didn't expect to come out of it. But after we were looking at some of the drivers of our accuracy, that was one of the things that came out. If you're really on the outskirts of town, so to speak, even if you're a pretty big, urban area, if you're close to a border, there become disputes over who's responsible for bringing, the goods that need to go to a facility, for instance. And so that had a huge determining factor on whether or not they were actually able to get the kind of drugs and staff and things that they needed. And so that was a super, super interesting finding. And so my, default is always, add as much spatial information as you can in and see where the noise is and where the signal is.
Cool, thanks very much.
Yeah.
I have a question again about the training data and its availability. Do you run into bottlenecks? Because it sounds like you're doing a lot of surveys and also using geospatial data, but I don't know, like, do you have issues having a sufficient response rate that you might need for your model and things like that? So how easy is it to obtain that data?
Yeah, I mean, it's definitely a representativeness issue more than it is an availability issue. And part of it is, we at the Gates Foundation have the financial resources to be able to purchase or fund a lot of the kind of data collection things that we might need. So if we see a gap, we're usually able to fill it pretty well. But we find that one of the bigger issues is really understanding what that sample is representative of. For instance, if you're using satellite imagery to look at built infrastructure, it's actually a lot easier to see things in rural areas than it is to see in urban areas, even though, people think of urban areas as having better data, because in urban areas, we're all building on top of each other. And so from a satellite's perspective, it's really, really hard to see, what's an apartment building with a cafe downstairs. Whereas if you're in a, kind of in the middle of nowhere, you see a cafe, you see all of the people who live around it, and it's actually quite easy to figure those things out. And so that's always, I think, the big bottleneck for us is when we're looking at a sample. If you're looking at a survey sample, you're probably going to have higher representativeness in your urban areas. If you're looking at satellite imagery, you're probably going to have it more representative in rural areas. And so when you start to mesh these things together, your uncertainty gets a little wonky because your data sources have different confidence in the areas that they're able to represent. Same thing happens, of course, with whatever technology we're using to take surveys. If we're doing phone surveys, well, you have to make sure that people have phones, and people who obviously are, have lower income are going to have less availability for doing things like phone surveys, definitely not online surveys. If there's no computer in the house, maybe there's like one in an entire village. And so, if we're going to take a survey where there's one computer in an entire village, we're going to ask very different questions. We're going to ask, like, what is your community like, not what is your household like? And so those are the bottlenecks that we usually run into. There's no absence of data. It's just making sure that you know what your data is telling you instead of kind of making assumptions about the whole population just because you have an image of everything.
Thanks for that. That was really helpful in contextualizing. Like, it's about asking the right questions a lot of times instead of asking a lot of questions, I suppose.
Yeah.
Also, feel free to drop any questions in the chat if you don't want to unmute yourself.
I got a direct question here, which looks like I can read out loud. Okay. So you mentioned the goal of reaching minorities. Is there any work at targeting albino communities, specifically those in the albinism protection facilities? So those in Tanzania. I'm just curious if those people are being reached. So there are not, so the example given is of course in Tanzania. So we don't do targeting of specific communities within the work that I am funding specifically, because generally we're working with national programs. But that is something that we spend a lot of time both on the kind of care side of things, trying to make sure that the data and the analytics that we're producing are not exposing any specific communities that might be easy to target. So I mentioned the demographic work that we do. One of the things that we always do is make sure that, like, we're not exposing any particularly vulnerable populations. We don't report out about things like, sexuality, as an example, in our demographic statistics, even if we have that type of information. So that's something. But as far as specifically looking at albinism protection facilities, there's no work that I'm aware of that the foundation does in that area. But it is certainly a spatial data problem. So something I would encourage people who wanted to, if they wanted to look at that, there's a way. And then I got another one. So how can we as students get involved, and what skill set is one required to contribute to the cause? Oh, I love this question. Because so in my personal time, I am also, or was until COVID, I was a Girl Scout troop leader. And I would have my girls working on geospatial data problems for development, even when they were brownies, which is one of the younger tiers. So it's so easy, an 8-year-old can do it. I like to tell people. So there are so many ways to get involved. If you want to, obviously, go into the field of geospatial data science like myself, you can do that. But there are citizen science efforts that are out there. So there's a group and a website called OpenStreetMap that is kind of the Wikipedia of mapping. So anybody can contribute. And one of the programs that they run is the humanitarian OpenStreetMap team. And this is what I used to do with my girls. They have very kind of specific tasks that they'll have you do. So for instance, you saw the kind of hand-drawn maps to the digitizing effort. There are ways to go into the humanitarian street map team portal, and all they're asking you to do is put dots on things that look like buildings. And so you just all you need to do is go, and that looks like a building, put a dot on top. It requires really no training. All of the modules that you need to understand are right there in the application. And we've used that for malaria bed net distribution, for polio vaccination campaigns. We've used portals and data like that for COVID-19, for disaster. It's huge in disaster response. I can't believe I didn't even mention that first. So like after floods or earthquakes, they'll be looking at damage and just have people go in and say, like, this looks broken. This is a street that no longer can be traveled across. And so really, really interesting tasks that you can get involved with just through that. And then, talking to other people about some of those technology pieces that I mentioned earlier, having a better understanding of what the problems are in these developing communities, and how you might get involved. I mean, nothing is better than asking somebody directly, like, what is it that you need help with, and trying to fill that gap. And so I always recommend, especially if you're in a university, maybe you want to partner with a program that's in Tanzania, and you want to have an exchange where you just sit and talk to them about, like, what are the communities that you're facing, or problems that you're facing in your community. And maybe somebody who can solve some of those problems. And so I always recommend that people, number one, just go ask people what it is that they need. Very good question about how I got involved in this at the Gates Foundation. Because if you go and look me up on LinkedIn, I have a philosophy degree, and then I work at the Gates Foundation on maps, and then I get a business degree. Which seems a little disjointed if you don't know a little bit more about my history. So I have a background in computer science as well, a self-taught programmer. And when I started working at the foundation, they had me working with the polio program in northern Nigeria. So I showed, I think, a graphic earlier of the hamlet clusters, we call it. Let's see if I go, there you go. So the folks in the lower left-hand corner here, when I started working with the foundation, I was really helping them with the technology to help them find those populations that we knew that they were missing, because we were looking at satellite images, and we were looking at the plans that they had, and we were like, something's not matching up here. There are whole communities out here that just are not on your plans. And so I got involved helping with the technology piece of that. And I learned so much about the great need for maps and mapping infrastructure that I started talking to other people at the foundation about, you know, we have all this great data. We have it for Nigeria. We used it for polio. I bet you could use it for malaria. You know, I bet you could, you want to know where some of these, you know, what we called chronically missed settlements, where these people on the outskirts of town are. And people, you know, kept socializing that. And eventually I became this evangelist for the mapping program. And I was doing all this learning in my free time about maps and how to improve mapping infrastructure. And eventually they kept giving me more and more responsibilities. And I learned more and more of the technology piece. And now, you know, 8 years later, I'm running our centralized mapping program. So I always tell people, you know, just because it's not in your job description doesn't mean that you can't get super interested and passionate about it and eventually end up being one of the world's leading experts in geospatial mapping for health and development. Yeah, so this is a good one. So what are some of the key differences and how GIST types, so like my team's efforts, look in developed versus developing countries, and how do the methodologies differ? I think one of my favorite examples for this is in agriculture. So in agriculture, especially in the developing country, the more developed countries that we work in, they have drones that they can fly over these large agricultural fields that have AI on the drone or on the computer, the down station, that can run analytics in a day. And this is technology that even I've worked on, that you can, you know, in a day understand, you know, crop disease, pests. You can understand the soil health. You can understand nutrients in the plants and the soil. And that's something that, you know, obviously if we're trying to do things like improve the nutrition in an area, having an understanding of what the crop health and what the nutritional value of those crops are is incredibly important for better health outcomes. That same technology, being able to use vision, computer vision, in order to determine crop health and soil health and nutritional value. We can run programs like that on satellites, but they're not as precise because the pictures just are not as good from space as they are when you have a little drone flying around, you know, 6 feet above the ground, or, you know, sometimes it's higher than that, but it's still pretty close. And so what we try to do is we try to adapt those methods, and we use what we call different spectral signatures. So the NASA has some very cool satellites that are looking at infrared. They're looking at shortwave infrared. So different light frequencies. They're looking, you know, obviously they're collecting color images. They have all of these different sensors that they put on board. Whereas, you know, on the drones, we're usually using just color. We're usually just like, we can use red, green, blue, and generally figure these things out. These giant satellites that we're using from NASA have all of these other technologies on them. And so from a geeky standpoint, for people like me who like to get in and play with the different spectral signatures, you know, I'm able to use a bigger suite of technology. But I'm solving the same problem that if we had better data on the ground, that was just a picture, we could solve the problem with. So it's totally different scales. And the science, you know, I'm not going to say is actually more fun in some of these developing cases, because it's more of a puzzle than it is when you have the technology more readily available at your fingertips.
Mike Rhodes here again. Another question. It sounds like the data sets you guys have are fascinating. Do you guys publish them open source or at all?
Yeah, so just about all of my investments have portals with data. So we as the Gates Foundation don't have like a Gates Foundation, data website ourselves, but we, so Grid3 is the example that I have open right now. They've got a website, grid3.org, and you can see a whole data catalog of the things that we've been able to collect over the last few years in these countries as part of their spatial data development. And I'm always very proud because that was one of the investments that, again, when I was championing things across the foundation, that was one of the first efforts that really got cross-funded by different programs for this kind of core spatial data need. We also commit a lot of our data to the Humanitarian Data Exchange, which is a UN data portal that a lot of our grantees and folks within the foundation who work with data will make our data available that way. Some of it is in OpenStreetMap, which I mentioned earlier, which is kind of that like Google of maps. If it's kind of core mapping data, we try to make sure that it's available in that resource as well. Just a lot of the grantees are posting and publishing things in academic journals as well. All of our academic research that we fund through the Gates Foundation is beholden to our open research policies. And so they have to be made available in a non-pay way for people to be able to replicate the research that's being done. And so all of that is made available through journals. And I think that there is a website where you can actually look up all the things that we have done research on, but I'm not remembering the name of it right now. But if you go to gatesfoundation.org, I'm sure that there's things about our open research policies and how you can learn more about that as well. But yeah, grid3.org, humanitarian open data, humanitarian data exchange, and then OpenStreetMap are the big ones.
Cool, thank you. Very cool.
Yeah. And also, like, people sometimes just email me and say, do you have any data that looks like this? And I can find it. That's part of I'd say 1/7 of my job is just people asking me, like, does this data even exist? And where would I find it? Which is kind of a fun job.
Nice. Neat.
Yeah.
Right. I guess we're close to the end. Again, if you have any further questions, feel free to add them on chat. One final question I have, Io, is do you know of any efforts at the UW where that students might be able to get involved in that do this type of geospatial data analysis or work with AI models that use this type of data?
Yeah, I haven't worked too much with university schools around geography, but I have worked with the information school, so the IA school, quite a bit on some of the new technologies pieces that I mentioned at the end of this. There are, I know groups that do work on things like humanitarian OpenStreetMap team projects, just kind of grassroots mapathons that happen. So always interesting to go to the humanitarian OpenStreetMap team website. HOTOSM is the acronym there. And you can get in touch with other people in the community, especially in the university, who also work on humanitarian projects. And yes, Shruti, the answer to your question is yes.
Sweet. Okay. Yeah, if no other questions, I think this is it. And Io has been nice enough to also open up some, I guess, office hours or today. I don't remember the time. Emily, if you have the time.
I've got it. So tomorrow, I have some time from 2:30 to 3:30. If folks want to pop in and have a conversation with me, you can get in touch with Emily and Shruti, and they can give you my information. You can pop in and say hi and ask me questions and ask me to find you data, because that's like my favorite thing to do.
Awesome. Thank you so much. And thank you so much, everyone. Yeah, Emily has your email there in case you want to get in touch with Ayo and chat more about her work. So again, thank you, everybody. And thank you so much, Ayo, for this awesome work and presentation.
Thanks,
Right?
everyone.
Thank you.